Welcome everyone to this next session of anesthesia training. Today I'm going to be talking about getting ready for general anesthesia. So there are a couple things that I like to go through in my head before I start any sedation, any general anesthesia on someone's pet. And there are a couple reasons why I go through this checklist every single time for every single patient. So why is this important? Here's why I think you should care about this. Number one, legality. So we need to make sure that legally the owner has given us permission for the procedure and that we have signed intent forms for those things. They need to be scanned into the computer. That will cover us in case of an emergency. Second, efficiency. So if we have all of our equipment ready for ourselves, the patient, and the operating surgeon, that way we're not going to be spending time later looking for it, wondering if it's lost, wondering if it works. We're going to know before we start, and then we'll be more efficient. Safety is the last reason I talk about this. So if you have things ready for your patient, they're going to be right there for you. You don't have to wait any longer to provide an intervention. If your things aren't ready, working, and set up properly, there's always the risk that you have to leave the patient, that something happens to them, or that they become unstable during that time. Don't put yourself in that position. Put yourself in a position of strength instead. So those are reasons why we should be doing these kinds of things. So when I think about getting ready for sedation or general anesthesia, I like to say to myself to do my head to tail checklist. So that for me means going through the parts of the body of the dog and saying, do I have everything I need to get this procedure done? Do I have all the people I need to get this procedure done? So what I say when I go through this checklist on a basic level is the patient ready? Do we have the necessary drugs, equipment, and setup for this type of patient and this type of procedure? Am I ready? Do I have the necessary forms, equipment, and interventions that I need to provide good quality care? Is the surgeon ready, or is the other clinician ready? Are they ready to do the surgery, do the abdominal ultrasound, run the CT? Do they have all the things that they need so you don't have to run away and get those later? And lastly, is the room ready? So if you're using CT, is the CT scanner warmed up? Do we have requests? Is radiology set up? Do you have monitoring equipment in there? These are all things that you should be asking yourself before you get started. It's going to save you time, save your patient, and save a lot of effort going forward. So I'm going to break down the head to tail checklist into a couple different categories. I want to talk about things that you might need out here in the prep area, and then I want to talk about things that you might need there in the actual operating room. This will be surgery specific today, but you can apply this to absolutely any area of the hospital. So the ICU, imaging suites, and other services should you be working on those. So the out here checklist, this to me refers to things that you're going to need for the prep table for getting the patient ready for either sedation or general anesthesia. Things you need to make sure that you have in place before you get started. Code status permission, patent ID catheter. You need to have permission from the client to perform the procedure. You need to have documented code status for the patient. And you need to make sure, if one has already been placed, that the patient has a patent IV catheter. You might as well find that information out now and not mess around with that later when you realize that the catheter doesn't work or we actually don't know what the code status is. Just figure it out now and it will be so much easier. The next thing you're going to need are induction, intubation supplies, and a correctly set up anesthesia machine. So before I get started on every procedure, at the top of my prep table, I make sure I have a box for the patient. This is going to have pre-meds, induction agents, intubation supplies in it on a basic level. You always need to have a little bit extra induction drug, not just what you've calculated, because you'll need it in case the patient gets light. In terms of my machine setup, even for sedations, I'm going to set up an anesthesia machine and monitor. So I'm going to make sure that my Sodasorb has been recently replaced and that it's not exhausted. I'm going to refill my vaporizer, and I'm going to do a leak check of a breathing system. I give oxygen to all my patients unless they tell me that they really don't want it and aren't cooperative. So I'm going to make sure I have a mask with a diaphragm on there. For intubation supplies, I always like to have a buffet of endotracheal tubes. So don't just get one, get a few. And make sure that you leak check them before the start of general anesthesia. You're going to need things to secure the tube. So make sure you have something like a gauze tie if you don't want to touch the patient's tongue. I don't like doing those things. And something to secure the tube to a part of the animal's body. Eye lubricant is extremely helpful. Sterile lubricant jelly for the endotracheal tube cuff is also very important for creating a seal on the patient's trachea. If you have available and if you choose to use a laryngoscope, make sure you know that the lamp is working, but do not leave it open. You can open it to check the light and then fold it down. Otherwise, the blade gets hot. So set that up with the blade you like and make sure that's sitting on your prep table, nice and within your reach. You're also going to need anesthetic monitoring equipment. So the purpose of the anesthetist or the anesthesiologist is monitoring. We need to make sure that the patient is doing okay. So I do this for every sedated, every anesthetized animal. Make sure that your monitor is close to an electrical outlet that you can plug it in. Make sure that all of your cables are present and plugged in good working order on the monitor. It never hurts to turn it on before you get started with the case. Frequently, cables get lost or damaged. Make sure that you have cables that are working prior to the start of your patient's case. There are a couple other things that we might need to throw in the prep table before we roll into the OR, and these are things like prep equipment. So this is what I'm talking about. If you are prepping a patient on a surgery table, just on a mat, cover the table with a towel, try to prevent the patient from getting so cold. If you are going to put the patient in different recumbencies, having things like gel blocks or weights or towel rolls can be very helpful. So especially if you have a very lean animal, please consider putting those out beforehand. Also falling under the category of prep equipment is things to physically prep the patient's leg, abdomen, chest, what have you. You need clipper baits that are clean and sharp. They need to be able to cut through the hair. Spray lubricant and cleaner plus toothbrushes can be very helpful for that as well. You need to make sure that you have scrub solution. Saline, alcohol, chlorhexidine would be appropriate most of the time. If you are doing things around mucous membranes, then typically what is suggested will be something betadine based. But please defer to your operating doctor in those types of scenarios. Other pieces of equipment you might need to set up before heading into the OR, syringe pumps. If you have a patient that's getting blood pressure support drugs, antibiotics, or constant rate infusions, you're going to need this and you're going to need delivery sets. Make sure that you get those out and perhaps put them inside your drug box before you get started. If you have a critically ill patient and you decide to place an arterial line, make sure the arterial line is labeled. You can put that sticker in your patient's drug box and set up the transducer and the pressure bag in the OR before you move in there. Other things you might need out here, make sure you have a tablet or a way to record the anesthetic monitoring parameters, and your cell phone if you are using one. You need to be able to call someone in the case of an emergency, and you need to be able to be connected to others. So those are things that I like to have out here before I move into the OR. Now, let's talk about the in there checklist. So these are going to be things that are going to be inside the OR. You've already set them up. Things that will help you move from out here to in there and complete the procedure without further delays. So the in there checklist includes things like surgical and anesthesia equipment. Do we have the appropriate packs put on the table for the surgeon's procedure? Do you anticipate there's other pieces of plates, retractors, suture material that they're going to need? Great. You should go and get those things ready before we start general anesthesia. You'll need your anesthesia equipment as well. So absolutely everything that you did to make your machine ready out here, you need to do the same in the OR. Needs to be leak checked, needs to be filled with inhalant anesthetic, and the sotasorb and valves and everything need to be in proper working order. If there's ever a question, you should ask someone or perhaps use a different piece of equipment. You're going to need a gurney, right? So just me personally, I don't like carrying patients. I'll never trust myself not to lose grip of them, especially if they were to become light. So make sure you have a gurney for pretty much every size patient. That way you can carry things like your extra equipment, your towels, perhaps your drugs. It's just a really nice way to get everything all in there. In the OR, other things that you're going to need to make sure you set up, IV fluids. So typically at our practice, prep times for surgeries tend to be short, so we're not usually setting up fluids in the prep area here, but you should have primed a fluid set, chosen the appropriate fluid rate and type, and then set that up in the OR on the pump. If you have a patient where their hourly rate is less than 60 mils an hour, I highly suggest using a syringe pump so that you can deliver fluids and not waste an entire bag per AHA hospital standards. Other things that you're going to need in there, we're coming to kind of the home stretch now, heat support. So hypothermia is the number one cause of a prolonged anesthetic recovery. So make sure in there that you've turned on a forced hot water blanket if your practice has one. Bear huggers can be extremely helpful, so setting up those with either the specified bear hugger attachments or with a system of towels and pieces of tape to keep your patient warm. Those are going to be really important for making sure your patient has a timely recovery. Lastly, and hopefully we don't have to think about this too much, but it's always better to have these things and not need them than to need them and not have them. Make sure that aside from the surgical and anesthesia equipment, you also have some emergency drugs in the OR and in the prep area nearby if your patient is sick. So make sure that you have things like reversal agents, adrenergic agents, and common CPR drugs within a close reach of you. You never want to be looking for these things when you need them. You want to know that they're there, they're not expired, and you have plenty of them. So that's just one way to get a patient ready for surgery, but that's kind of how I like to think of it. Do a head-to-tail checklist and say, am I ready? Is the patient ready? And is the equipment ready? And you'll have things prepared and at your disposal every single time. And that's it.